Hi everyone, my name is Rainey Basterach with the American School of Hypnosis, and I'd like to welcome you here again tonight to our hypnosis segment. And what we'll be doing tonight is answering questions that people had sent in. This is actually part 2 of our questions segment that we started last week. So for everybody out there, hello, welcome, and if you have any questions, we only have a few tonight. So if we have time afterwards, think of your questions, go ahead and type them up. Luca can organize them for me, and we'll get to them after we're done these. So let's go ahead and get started. The first question was, should you accept insurance from a client for hypnosis? Good question. Should I accept insurance from a client? Personally, my opinion is no. I don't accept insurance. Well, actually, I can't, because unless you can accept insurance, such as a doctor, a psychiatrist, psychologist for services, they're the ones that collect insurance. But even if I were able to, I wouldn't. And matter of fact, most of the psychiatrists and doctors that come see us, once I explain this to them, they also say the same thing, that, well, with hypnosis, we're not going to accept insurance. The reason being, you heard the old saying, when you do something for nothing, it's worth nothing. That's basically how it works out with hypnosis. If you do hypnosis for nothing, let's say you want to hypnotize somebody to quit smoking. So you do an hour session, with of course, when I say for nothing, there's insurance, but really insurance is so little out of their pocket, it's pretty much for nothing. So when they have a hard time later on, they go to pick up that cigarette and they go, should I, it's a pen by the way, should I smoke this cigarette? And they go, hardly cost nothing, what the heck. But if I charge them $150, $200 for the session, and they get a craving later on, they're going to go, should I smoke this? That's an awful expensive cigarette. Maybe I'll put it off till later. You see what I mean? There's more of a commitment. The more of a commitment you can give somebody with hypnosis, the better it's going to work. Now, while we're on that subject, there's actually 3 different things you want to think of for a good session. Let's look at it as a pyramid, okay? The top of the pyramid, of course, is desire. Without a desire, they're not going to want to quit smoking, or they're not going to want to do anything. So they need to have a strong desire, okay? So that's the top corner of the pyramid. Down on the left corner, let's call it belief. They need to have belief that they can quit smoking or whatever it is they want to do. And they need to believe in you as a practitioner that you can do it, okay? If they come over and see you and they know that you have a great success rate and you look professional, you sound confident, chances are they have enough belief that you can do it. But if they walk into your office and you have a fan going around with one of those flea strips that's half filled with fleas, and there's half-eaten plates of food in the corner, and you got a TV set running, and you're wearing your pajamas, and your hair's all disheveled, chances are not only are they going to turn around and run out, but they don't believe you can do it. So you've got the desire, you have the belief, and the third part, which is just as important as those two, is the commitment. What's the commitment? The money, the bling bling as they call it, okay? They have to have committed something in order to change. If there's no commitment, why should they? Now, I have a lot of people tell me, yeah, but we do volunteer work. We work with people that don't make much. How can we, charge them? Well, if you can't charge someone, you can barter with them. I had someone write to me from, I believe it was in Indonesia a while back, one of our graduates, and he says, people here don't make a lot of money. How can I charge them? I wanted to do this just to help them. So first of all, if you're doing it for free, you're not helping them, because there's going to be no commitment, and they're probably not going to change. They're not going to heal. There's no commitment for them to want to do it. So you can barter with them, okay? I don't know what it's like over there, but let's say if they're all farmers and they don't have any money, well, maybe they can bring you a chicken. Maybe they can bring you a bushel of corn. Maybe while they're waiting for their appointment, they can tidy up or clean around the office. They can agree to do some cleanup work for you, okay? So there's always a way that they can barter to be able to have some kind of a commitment. You've probably heard the story of the old woman who's sick of some kind of disease, and she hears that there's a statue, this miraculous statue that cries in some country on the other side of the world. And this woman makes the commitment because she believes the statue can heal her, to go all the way across the world. She goes through all these hardships, finally gets over there and touches the tear on the corner of the eye of the statue and is immediately miraculously healed. She might not have spent money, or she had to get there, but even if she didn't spend money, the commitment, the inconvenience she went through, and all the hardships to get there was the commitment. Okay, so let that be an example. There needs to be some kind of commitment. So they need to, the more they pay, the better it works. You do it for nothing, it's worth nothing. When you use insurance, it's usually worth nothing. Okay, so with hypnosis, to make a long story short, no, I would not accept insurance for hypnosis. Next question. Can hypnosis really help individuals meet their spirit guides? Aha. How do I answer this one? In our course, matter of fact, in our hypnosis manual, we have in the metaphysics section, the chapter way towards the back, we actually have some scripts for meeting your spirit guides. I believe the one for meeting your spirit guides is part of the past life regression one, where they meet their spirit guide on the way. So obviously, if we have a script for it, they can do that. That's a good answer, right? If we have a script for it, you must be able to do it. Okay. However, it all has to do with belief. Some people believe in spirit guides. Some people believe in spirit animals. Some people believe in, who knows, that there's no spirit guides, but there might be family there. Some people might believe in totems. So it has to do with your belief system. Whatever you believe, if you truly believe it, yes, you can do it with hypnosis. Because what is hypnosis? It's based on, of course, suggestibility, but also belief. Imagination. If you can imagine it, it can happen. If you can't imagine it, it can't. So can you really help individuals meet their spirit guides? If they believe they can and you have a script for it, yes, you can. If they don't believe they can, even a script's not going to help. Okay, belief is the biggest part. All right, third question. This is there anything that we as practitioners can do to help keep an analytical thinker on track, to help them relax more? I know some use light therapy, but for those of us just starting out, what can we do? Any help on this topic would be appreciated. Okay, I think first there needs to be a better understanding between what an analytical thinker is. Okay, there's analytical thinkers and there's the non-analytical thinkers. Okay. Non-analytical thinkers like to relax. They enjoy relaxing while they're doing things. That's why we use a relaxation techniques in hypnosis to hypnotize them. Analytical people don't like to relax. Okay, they say we'll relax later, but later never seems to come. They like to keep busy. So when I look at the question, is there anything that we can do as practitioners to help keep analytical thinkers on track, to help them relax more? They probably don't want to relax more. Relaxation is not a requirement for hypnosis, as you know, the way we teach. It's nice, but it's not required. So if they don't enjoy relaxing more, why doing it? Now, if they come up to you and say, hey, I want to relax more, if that's the case, then yeah, all you need to do in that case is hypnotize them using an analytical approach, using the analytical vehicle like you have in the manual. And while you're hypnotizing them, give them suggestions to think more non-analytically. So you're hypnotizing the analytical mind to be more non-analytical, or hypnotizing them to relax, hypnotizing them to be less critical, less analytical. Of course, when you go to a non-analytical person and say, watch the butterfly descend slowly, and you're relaxing more and more, they just follow it and get into it. But the analytical person, why are you saying a butterfly? Are you saying I'm flighty? Are you saying that I have wings like that? Are you making fun of me? They're so critical of things, they don't want to let go. So they're going to have to want to. And again, if they want to, they can. So really there's not a purpose for it. There's not a need for it. But if they want to, give them suggestions and it should work fine. Okay, let's see. The next one. At what point exactly in a performance does the subconscious mind start to receive the relayed, in parentheses it says, script for change? And how soon does it act on the suggested information? Okay, that's from Chris. That's interesting, Chris. At what part of the performance does the subconscious mind start to receive, I guess you're saying suggestions? Well, the subconscious mind receives suggestions right away. How quickly does the subconscious mind act on suggestions? The subconscious acts on suggestions immediately. That's something a lot of people don't realize. When someone comes into your office, we're going to get away from comedy for a minute, and we'll answer the question by going with a clinical atmosphere. When you give somebody a suggestion to quit smoking, they're a non-smoker immediately. In the subconscious mind, there is no time. Past, present, future, or past and future is only in the conscious mind. In the subconscious, the true subconscious, there is only now. You've heard Eckhart Tolle with his book, The Power of Now. That's the true subconscious. There's only now. So when you want to heal someone, you want them to quit smoking, healing happens now. Quitting smoking happens now. But what happens? They say, well, I want to heal as soon as I can. So they tell them the mind that I want to heal at some future date when they say I want to heal. Otherwise, they say I am healthy. So if they say I want to heal, the subconscious mind says, I'll wait. Let me know when you're ready. And when you're finally ready to heal, it will heal you immediately then, because that's all it knows how to do is now. So the reason we don't heal right now, the reason things don't happen right now is because mostly we don't believe, or most people don't believe it can happen now. If they believed it could, it could. Healing could be instantaneous. I wake up in the morning, I get a runny nose, feel like I'm having a cold. I put myself in hypnosis and say, I am healthy, and it goes away. I don't have to go through a whole week of having a cold. That's a choice. That's people say, I want to get better. I'm getting better. Well, getting means lack of being healthy now. It means later on, okay? I am healthy means exactly it. I am healthy now, and the subconscious mind will respond as such. So with comedy, how quick do the suggestions take? Right away. Again, will they act on them right away? It depends on their belief system. If they want to, you can deliver the suggestions. The mind always accepts them, but it can also rebel against them, or shoot them out as quickly as you gave it to them. So it's up to them completely. So again, belief, acceptance, you're all set right now. But again, explaining that to your client will help them a lot as well. Okay, next question. Is it possible to hypnotize people in the early stages of Alzheimer's or dementia in order to record their family history? I talk with so many families that have elderly parents who can no longer recall their family history. Thank you. This is from Bill. Well, Bill, is it possible to hypnotize Alzheimer's or dementia patients in the earlier stages of that? Yes, it is. You can hypnotize anyone. Now, I would suggest that you try it. I mean, don't take my word for it, okay? I think if it's in the early stages, they could. But the only way to find out is trying. Remember, hypnosis isn't going to hurt anyone. It only helps. It helps them to relax. Now, what happens when you relax someone? When they relax, they go from the beta brainwave state, which most of these patients are in beta most of the time, and they relax. As soon as you close your eyes, you go 80% into the alpha brainwave state. Now, what is alpha? Alpha is where memories are stored, short-term memories. Everything you study for a student goes into the alpha brainwave state. Everything you notice throughout the day goes into the alpha brainwave state. That's where it's stored. All your long-term memories, early childhood memories, even traumatic memories, go into the theta brainwave state, okay? And of course, we talk a lot about the brainwave states. And if you review that, you'll see a lot of that there. So the long-term memories go into theta. Now think of it, memories are not stored in any specific compartment in the brain. They're stored in the same places as your hopes, fears, goals. So they're stored out there. They're stored in the universal consciousness, if you want to call it. Now, the way I look at it, okay, this is the gospel of the medical according to Rainey, so check with your doctor, there's my disclaimer. Okay, the way I look at it, Alzheimer's and dementia is a physical thing going on with the head. There's many reasons for it. Some of it's diet. Some of it might have been because of a sickness or a disease. So there's a lot of different reasons that it happens. However, it's physical, whereas the mind or thought, memories are mental. They're into the different stages. So if you can get them into alpha, into theta, into the different brainwave states, the information is there. The information is there to be retrieved. If they're able to retrieve it or not, again, that would have to do with the person, with their belief, with your belief. So there's a lot to play with there. So my simple answer would be try it, see what happens. If it works out well, let me know. I'd like to share it with everybody on here. It's always interesting to hear some of the things that people say. Same as with any kind of mental health, mental issue. We tell people anyone that can understand the language can be hypnotized. The only ones that really can't be are people that can't understand the language or people with severe mental health issues. Okay, how severe? Because I had people, so a lot of people saying, well, how about Down syndrome? How about all these different things? My answer to them is the same thing. Go ahead and try it. See how it works. If it works well, let me know. And I have, and that's true. So be careful trying hypnosis on psychotics or those with severe mental issues. First of all, if they have kind of severe mental health issues, it's very important that you work within your realm of practice. Matter of fact, the person that sent me this last question about the Alzheimer's was actually a PhD. Work within your realm of practice. If you're not trained, if you don't have a mental health degree, don't deal with mental health issues. If you don't have a medical degree, don't deal with medical issues. It's important to work within your realm of practice. Not only because of liability, where if anything happens, insurance won't cover you. Neither will the association back you because you're not working within your realm of practice. But most importantly, it's just common sense. That's one of the problems with people calling themselves hypnotherapists, that title that a lot of states still accept. Some kid straight out of high school comes to school, gets trained as a hypnotist. He can call himself a hypnotherapist, and all of a sudden he thinks he's a therapist, okay? You're not. You're actually a hypnotist, or what we call our people, hypnosis practitioners. You can practice hypnosis, but you really cannot practice hypnotherapy unless you're trained in therapy. And that's something that we'd like to see really pushed, by any kind of regulation in the future. But unfortunately, since there is no federal regulation with hypnosis, a lot of states will allow people to call themselves hypnotherapists when they really shouldn't. They're really, you see some people with titles this long. I'm a certified, qualified, clinical hypnotherapist, and it goes on and on and on. Some of these people, John Smith, named this small with titles so long I can't even put them on the certificate, okay? Hypnosis practitioner is fine, okay? If you're in a state that can call yourself a hypnotherapist and you're not a therapist, I would still stay with hypnosis practitioner. When people see the word hypnotherapist, all of a sudden they're calling you for all these mental health issues. Don't get into them. And if you are asked to work with something like that, don't do it unless, if you're not a practitioner, unless you have written permission by the doctor or psychiatrist to do it. Dr. Robbins says, amen. Well said, Randy. Amen, brother. I had one of my what I call lifelong clients, okay, elderly woman, really nice lady. She used to come see me a lot for stress, relaxation, these kind of things. And she liked seeing me so much that one day she says, I'd like you to, to see my daughter. My daughter has some issues, basically there were mental issues that I'd like you to deal with. And I told her, I said, no, I'm not trained to do that. I'm not a psychiatrist, psychologist, so I cannot do that. And she says, whoa, I trust you, please do it. And I says, I don't care if you trust me or not. I says, the only way I can do it is if she speaks to her psychiatrist, who she was seeing a psychiatrist at the time, and he gives me written permission. In fact, I was thinking she might do that. I said, in fact, he's going to have to come to the office. I'll hypnotize her. When I get her into a nice state of hypnosis, I'll pass him over to the psychiatrist and he can take over. Now, of course, she said, I'll look into it, but of course, a psychiatrist will never go for it, and that's why I did it. I didn't want to, be rude to her and say, I'm not going to do it, but by saying this way, it got me out of the hot soup, okay? So work within your realm of practice. That's very important. Well, that's pretty much all the questions we had here tonight. Most of all of them we handled last week. So if anybody over here on the chat line has some questions that you'd like to know about, go ahead and throw them out real quick. I noticed, let's see if anybody typed anything yet. Nope. So if anybody has a question, I'll give you about 15 seconds to type something really quick. And if you can't type it that quick, say, hold on, I'm typing, so I know. And we'll go ahead and answer those. Otherwise, we're going to move on and give you folks all a nice short night. Let's see, anybody have anything? Reluki, you see anything going on your end? Oh, she's saying no. Oh, I see the word question. Okay, we're going to hold on and let them type the question. Hold on, please. That's a statement. Let's see the question. What do you think about hypnosis with the dental field? Okay. Now, expand on that. Do I think it works? Do I think it's a good idea? Okay, well, that's another question. Okay. Well, let's talk about the dental field. A lot of dentists, oh boy, we're getting all kinds of stuff. A lot of dentists really like hypnosis because there are a lot of their patients that can't take anesthesia, okay? And that was the question, unable to handle anesthesia. Okay, I see that now, great. A lot of patients can't have anesthesia, so with hypnosis they can go in and be hypnotized to be able to have the procedure. Matter of fact, I actually had a tooth extracted once. This is kind of funny. Well, to preface this, before it happened, I had someone working for me. My secretary, who was also a hypnotherapist that did sessions once in a while, came up to me. She said, I had a root canal done with hypnosis. She goes, wow, it was great. And I remember telling her, I said, I think you're insane. I don't see how you would ever do that, even though it can be done. I told her, I said, you're nuts. Well, about 2 weeks later, I had an abscess tooth that had to be yanked. And the dentist I normally go to was closed because this was like a Sunday night. So basically, or Sunday afternoon, I was in pain all night Saturday. So I called around, found this guy that would see me. Old-time dentist, right across the street from my office, okay? So he knew of me, and so did everybody that worked there. I get into the place, get sitting down in the chair, all ready for him to extract my tooth, and he hadn't given me Novocaine or anything yet. And all of a sudden he says, hey, everybody, come in here. I want to show you something. So his secretary, the nurses, all the people working there all came in. There must have been about 6 or 7 of them. And he goes, I want you to watch this. He says, I used to have a partner that was a hypnotist, and I could do all kinds of work with him without anesthesia. So watch this. All of a sudden, zzz, and he comes down with me with the tools. And I was like, oh my God, he's doing it to me. Okay. So immediately I said to myself, the light is anesthesia. And I kept on looking at the light, and as long as I was looking at the light, I felt no pain. Now remember, fear is a great motivator. I was scared to death, so it worked really well. Now, of course, every time you get in front of the light, the pain went away. So I changed it from the light to, I believe it was his glasses or something, looking at his glasses. But I changed it to something on him so I would be not in pain while he was working on me. So firsthand, I know it works, okay? Matter of fact, just recently I had a root canal as well, which I used a lot of it, but we had a little bit of drugs there, so that was good. Now to do it, there's 2 different ways of doing it for dental work. Number 1 is you can give somebody a post-hypnotic suggestion while in the office that when they get into the dentist's office, he'll give them some kind of a cue, a verbal cue, and they'll immediately come back to this level. They need to be in level 4 of the Aaron's depth scale, okay? It's not quite anesthesia, but it's analgesia, which is pressure but no pain. So level 4 is the best level. Level 5 is a little too deep because they won't know what the dentist is working on. So one way to do it is you bring them in hypnosis, then you take them back out. When they get to the doctor's office, he gives them the post-hypnotic word, it could be horse feathers or whatever, and you immediately go back into hypnosis. The other way of doing it is, if they're coming to see you just before the session, is to bring them in hypnosis and leave them in hypnosis so they could drive to the office in level 4. That doesn't seem to work as well, because what's going to happen all the way down to the office, they're going to say, did I feel that? Did I feel that? I think I felt that. Oh no, I felt that. And they're going to basically psych themselves right out of it, okay? So leave a little mystery and do it with a cue word, and it's going to work better for you. Now you may have to practice with them a couple times until you're certain that they can get to level 4. Pretty much anyone can. The only thing that would stop them is their own belief, okay? So that hopefully answers the question on dental work. Let's see, what else do we have? What's the youngest a person can be hypnotized? depends how you're going to hypnotize them. Hypnotizing children is very easy because they're constantly in a hypnotic state already. Would I bring them into my office and sit them in my chair and go a whole session? That's kind of overkill. So just for your own knowledge, okay, if you understand the brainwave states, children from age 0 to 2 are in the delta brainwave state. Basically from 2 to 6, is it, Rebecca? 6, right?
Yeah.
2 to 6, they're in the theta brainwave state primarily. 6 to 12, they're in the alpha brainwave state, and 12 on, they're primarily beta. So think of that. Most of the hypnosis you do is in the alpha and then theta brainwave state. So they're there already. So with children, you don't need to give them all the induction and the depth test and the deepener. Basically, have them use their imagination. Their imagination is really strong. So have them imagine themselves as the goal them. So how young can you do it? As young as they're able to understand. Okay, now you might not be able to sit them in a chair. Get a copy of my free manual online, and it shows you how to do sleep hypnosis, where you can walk into their room and basically you slightly wake them up, not all the way. You're bringing them to what we call the hypnagogic state, which is the state between sleep and wakefulness, and give them suggestions then. Works very effectively. Make them positive suggestions only, not to be used for punishment. It's great for bedwetting, nail biting, anxiety, stress at school, confidence, those kind of things. The whole thing, and if you snuck into the room and did it, should probably be 3 minutes tops, okay? Very quick. So knowing that, if you're going to be doing it as a session, basically all you have to do is give them suggestions. Give them, have them use their imagination and seeing them as how they want to be. They're already in a hypnotic state, until age 12, so keep that in mind. Let's see. Fear of needles, anesthesia. I don't understand what the question is for that. You can hypnotize people for fear of needles. There's plenty of scripts out there. Matter of fact, we have some in our hypnosis manuals. Yes, I don't know if that answers it, but you can hypnotize people for fear of needles and for anesthesia. So put that together and figure out. I'm not sure exactly what you wanted with that. Let's see. Or unable to handle it. Yeah, that was the part about the dentist. So I think that pretty much answers all those. When you're not sure what can be done with hypnosis, okay, if you can create a script, if it's something that you think can be done, I mean, it's like I said, it's not going to hurt someone as long as it's something that's, not mental health issues, but simple things. Go ahead and try it. It never hurts to give people positive suggestions. Okay, we get an explanation here. Yes, I meant using hypnosis for those who cannot take anesthesia. Okay, great, yeah. Yeah, a lot of people can't take needles, so you can hypnotize them for fear of needles so they can use a needle, okay? Or you can just have them use hypnosis to, instead of the needles. Or maybe even give them a combination of both. Why are they afraid of needles, You might be able to hypnotize them for that and give them positive suggestions about how needles are good, how they help. I mean, for taking blood, there's so many good things for giving vaccines, all these things that can help people. So maybe give suggestions for both if they want to try it. Otherwise, do whichever one you think is best. Any work done on hyperactive kids? Now that's another totally different topic. When you're dealing with hyperactive or ADHD, or again, are they going to be able to sit still enough to relax? That's just it. I hypnotized a kid once. Oh, this was back when we were in Philly, so quite a few years ago. The mother asked me to hypnotize him for, I think it was bedwetting. I'm sorry?
Fear of balloons.
Oops, I'm sorry. It was fear of balloons. I was corrected. Fear of balloons, okay? And now I had him, he was probably about 13 years old, 12, 13 years old. I had him sit in the chair. And now kids are normally non-analytical, okay? So, again, I've never met, I'm sure there are analytical kids, I've never met one. They've all been non-analytical that I've seen. So I put this kid in the chair and seemed like an average, everyday, happy kid, and started hypnotizing him, and he just wasn't relaxing. I'm wondering, what's going on? His mother on the other side of the room is writing on a piece of paper, and she hands me this note. And I look at the note, she goes, I forgot to tell you, but he has ADHD. would have been something great to know, okay? So in that case, he wasn't able to focus on me. He wasn't able to pay attention. So in some cases, with hyperactivity or different, things like ADD, ADHD, you might not be able to get them now, but one of the last kids that I did hypnotize that I found out had ADHD, she went to counseling, got the medication. Now, medication doesn't cure it, but it helps to level them out so they can think like other kids. And once she was leveled out, then I was able to hypnotize her and give her suggestions to eliminate the ADHD. And I'd say probably about 3 or 4 months later, the counselor she went to see took her off the medicine and she was fine. So again, maybe you can't get them now, but if they're on medication, there's a chance you can. So it all has to do with, will they understand you? Will they be able to take suggestions from you? What are they like? If they're too hyper where they can't even sit in a chair, you're going to probably have a tough time. In regards to youngsters being hypnotized, how will one know if they are emotional or physically suggestible, taking into account kids are non-analytical? Well, you can do the test. I mean, I have, like I said, pretty much everyone I've seen has been non-analytical, I didn't really even do a test with that kid because I just, took for granted, hey, you're another kid, my bad, but do some of the suggestibility tests, see how they respond to it. The finger test, the arm rising, falling test. Do some of the extreme non-analytical ones, like the postural sway, where you have them stand up, you put your hands on their backs, and when I pull my hand backwards, you're going to feel a strong magnetic pull and you're going to fall backwards. If they fall backwards, yeah, they're very non-analytical. There's a lot of things you can do. You can start talking about a lemon and cutting a lemon in half and squeezing the lemon. If they start going, as you're talking to them, they're very suggestible. So there's a lot of different tests. Again, if you don't have any of those, go in our manual, the free manual, choosehypnosis.com. There's a commercial, and it's free. Put in your name and email, and you can download our 443-page hypnosis manual that has all that kind of stuff there. So that's it for tonight. Thanks for the input. I really like the questions, and we will see you all next Tuesday. And come on, let's get more people here. Tell your friends about it. Get them over here. And during the week, I'll send out an email letting you folks know exactly what we're going to talk about for next week's subject. So until then, have a great night. Have a successful week, and thank you for coming.